Value-based care comes with a lot of risk for doctors. It means that any variation from normal cost is on them. And it's so much harder for them to see how the codes they enter actually impact their paycheck. Helping doctors code things properly so they get paid for the value they offer is where we can help. So we decided to assemble some super smart people powered by the power of SaaS to see what we could come up with and tackle this problem for our docs. Here's Peter Kirkwood to tell us a little bit more about the problem.
I've been fascinated with medical billing since I heard back in 2007 that over 40% of the staff in a hospital are in billing-related jobs, and they only succeed in collecting 60 cents on a dollar. There's massive waste here, and we can do better. Value-based care is the fastest growing segment in healthcare, and Medicare is aiming for 100% value-based billing by 2025. This is great for patients because this payment method rewards doctors for keeping patients healthy by paying them the average projected cost for that patient pool. This stops doctors from ordering redundant or inefficient tests and procedures because they don't get paid for doing more stuff. They just want you healthy. The problem is doctors have a very hard time understanding how they're getting paid and how the diagnoses they put in matter. We can help make that clear for them and get them paid what they deserve. The statistics on medical billing problems are daunting, and when you consider that 18% of the GDP is committed to healthcare, and that's the system that keeps us and our loved ones healthy, this is a real problem. The financial losses aside, these challenges make healthcare so much less efficient because people are managing the system instead of caring for patients. And patients have to worry about how to get reimbursed for bills that could otherwise cause them major financial problems. We can help. With over 5,000 hospitals, more than 230,000 medical practices, and hundreds of insurance payers, it's no wonder this is a big challenge.
Everybody likes finding more money. A few percent may not seem like a lot until you consider that medical practices have huge fixed costs for insurance, staff, facilities. What's left at the end of the day is only a small slice of the revenue. And adding a few percent more can make a big difference. Here's Scott Koval from Pinnacle Solutions. He's going to show you a few things we found.
Using the SaaS Viafor platform, we created an analytic flow using SaaS Studio. A flow is a newer feature when using this solution and is very similar to process flows from SaaS Enterprise Guide or analytic pipelines found in SaaS Model Builder. Each major part of the project has been separated into its own analytic stream. There are 5 in total and illustrate how we extracted, managed, and analyzed our data. These include streams for data connections, text analytics, association analysis, reimbursement scoring, and recode adjustments and rescoring of data. The first stream is a simple SaaS program and creates a connection to our data libraries as well as the Cloud Analytics Services server. These connections allow access to data in order to manage and analyze it. After these connections have been created, the next part of the project imported ICD-10 diagnosis codes. Important patterns were found within the diagnosis descriptions using text analysis. These keywords became predictors of whether or not a diagnosis would be reimbursable. The ICD-10 rules table contains the results, which were then used to score insurance claim data. In the next analytic stream, patterns of patient diagnosis were discovered using a type of association analysis. These patterns informed us of commonly occurring diagnosis codes based on the keyword terms that emerged earlier. The association rules table contained the results of the analysis, and a model was stored in order to score new data. Patient data was queried to prepare it for reimbursement scoring. By using patient demographics data as well as their individual diagnosis information, SaaS macro programs were used to determine the amount of reimbursement charges to be applied. The output table patient scored contains these individualized coefficient values. The final analytics stream uses results from earlier analysis to build a diagnosis recommender system to aid healthcare providers. By using the diagnosis keywords and associations, recommendations for ICD-10 codes are adjusted and the data is rescored with them.
Here's DJ Penix. He's the president and CEO of Pinnacle Solutions and a citizen data scientist. He's going to tell us more.
Taking the output from our text analysis, we can now build some visualizations. In this first report, we can see the difference between the reimbursable and non-reimbursable ICD-10 keyword description clusters. At a high level, many more of the non-reimbursable keyword description clusters have fairly generic wording. Words like injured or undetermined are much less specific than the reimbursable keyword descriptions like vertebra, ulcer, or mellitus. This makes sense as codes that are often rejected are due to being too general and non-specific. We also created a network analysis of the keyword clusters. This interactive visualization allows you to see specific keyword clusters of interest and see how they relate to other keyword clusters. The unsupervised model that was built provides the top 3 recode suggestions for all of the non-billable codes. In this portion of our solution, we built a web user interface using custom PHP code that would allow medical professionals and subject matter experts to review the recommendations, assign probabilities, and enter notes regarding the model results. This in turn can be used to further tune the model and introduce some supervised learning approaches to give us better results. Once we have confirmed and approved the new billable codes, the next step is to understand the financial impact of recovering this revenue. We downloaded the publicly available data from the Centers for Medicare and Medicaid Services so that we could calculate the Medicare risk adjustment values. While our claim data was real, it was de-identified due to privacy concerns, so we simulated data points for the age, gender, and ORIC categories. Here we see the total value of $332 million with the data as is and before we went through the process of recovering unbillable codes. But on this next report, we can see recovery of $7 million by utilizing the code replacements and recalculating the patient's coefficient score and dollar value. The rows in blue indicate patients that did not have any non-reimbursable codes. Their difference in the original versus the adjusted values will obviously be $0. However, the rows in green show the patients that did have adjusted values and 1 or more unreimbursable codes recovered. This report utilizes the SaaS feature of automated explanation. We use this reporting object to see what underlying factors are most related to total value in dollars. Here we can see that congestive heart failure is the most important factor to total value.
The bottom line is we found a whole bunch of lost revenue doctors wouldn't otherwise have gotten or realized was even missing. And the chart chasers were just the prescription. Everybody likes finding more money. But what everybody really wants is a healthy, long life.